Panic attacks and diabetes are distinct medical conditions that affect individuals in significantly different ways. A panic attack is a sudden episode of intense fear that triggers severe physical reactions when there is no real danger or apparent cause, often including symptoms like a pounding heart, sweating, trembling, shortness of breath, and a feeling of impending doom. In contrast, diabetes is a chronic disease where the body either cannot produce insulin, type 1 diabetes, or cannot effectively use the insulin it produces, type 2 diabetes, leading to symptoms such as increased thirst, frequent urination, hunger, fatigue, and blurred vision. Treatment for panic attacks often includes therapy, medication, and lifestyle changes to manage stress, while diabetes management usually involves blood sugar monitoring, healthy eating, regular exercise, and sometimes medication or insulin therapy. Risk factors for panic attacks may include genetics and stress, whereas diabetes risk factors typically include genetics, obesity, age, and a sedentary lifestyle. Here's a detailed look at the nuances of each disease to better understand their impacts on health. Onset of symptoms, acute versus chronic. A panic attack typically presents with an acute onset, manifesting suddenly and often peaking within minutes. Symptoms such as palpitations, chest pain, shortness of breath, dizziness, and intense fear can overwhelm the individual, mimicking conditions like heart attacks. Conversely, diabetes is a chronic condition characterized by a gradual onset. Symptoms like increased thirst, frequent urination, hunger, fatigue, and blurred vision develop over time, reflecting the body's impaired ability to regulate blood sugar. Recognizing the distinction between the acute presentation of panic attacks and the chronic development of diabetes is crucial for appropriate management and treatment of these vastly different conditions. Primary system affected, neurological versus endocrine. In the differential diagnosis between a panic attack and diabetes, discernment lies within the primary systems affected. Panic attacks pivot on the neurological system, with symptoms manifesting as intense fear, palpitations, and hyperventilation, typically episodic and acute. These are functional symptoms with no direct physical pathology. On the flip side, diabetes takes root in the endocrine system, characterized by chronic issues in blood sugar regulation due to insulin problems. Its hallmarks include frequent urination, excessive thirst, and unexplained weight changes. Recognition of these contrasting presentations and systemic involvements is crucial for accurate diagnosis and treatment. Trigger factors, psychological stress versus metabolic dysfunction. Panic attacks and diabetes, while vastly different in their nature and treatment, can occasionally present diagnostic challenges due to overlapping symptoms like sweating, palpitations, or weakness. For panic attacks, psychological stress is a predominant trigger, igniting an acute response from the body's fight-or-flight system, leading to a cascade of physical sensations that can mimic other conditions. On the flip side, diabetes is underpinned by metabolic dysfunction, specifically related to insulin production and glucose regulation. Unlike the transient nature of panic attacks, diabetes presents a chronic challenge where blood sugar levels are persistently unbalanced, requiring ongoing management. Understanding these trigger factors is crucial for healthcare providers to avoid misdiagnosis and to tailor effective treatment strategies for each condition. Treatment approach, psychotherapy and immediate relief versus long-term lifestyle management. When distinguishing between conditions like panic attacks and chronic diseases such as diabetes, the treatment paradigms show striking contrasts. Panic attacks often benefit from psychotherapeutic approaches and sometimes immediate relief medication, aiming to manage acute symptoms and underlying anxiety disorders. Cognitive behavioral therapy (CBT) and short-term use of anxiolytics can provide rapid resolution of symptoms. In contrast, managing diabetes requires a comprehensive long-term lifestyle modification strategy, including diet, exercise, and consistent medication like insulin or oral hypoglycemics to maintain blood sugar levels. This enduring management recognizes diabetes as a lifelong condition with emphasis on prevention of complications through sustained health interventions. Symptom manifestation, intermittent episodes versus persistent condition. When distinguishing between the intermittent episodes of a panic attack and the persistent condition of diabetes, it's essential to consider the nature and triggers of symptoms. Panic attacks often come on suddenly, with acute manifestations like heart palpitations, sweating, and a sense of impending doom. They are usually triggered by stress or anxiety and resolve within minutes to hours. In contrast, diabetes, a chronic metabolic disorder, presents consistently over time. Symptoms such as increased thirst, frequent urination, and fatigue develop gradually and linger until managed with medication, diet, and lifestyle changes. Unlike the episodic nature of panic attacks, diabetes requires continuous monitoring and care to prevent long-term complications.